We're not the forbidden doctor. I'm not the forbidden doctor. It's in you. The forbidden doctor is that magical, mystical power inside of you that's controlling and healing everything. It is that beautiful, marvelous, almost miraculous force that controls all healing. It's that innate intelligence, that life force directed influence that triggered your DNA to build your body after conception. It's that power that sustains your life. It repairs your wounds and lesions, and it never stops working. It is that essential part of you that keeps you alive, and it heals your every hurt. This is the forbidden doctor. It's not me. It's that part of you, the powers that be, have decreed forbidden to ever learn about or even consider and never ever rely upon. For it's forbidden that you even know that this life force exists at all. You are your own forbidden doctor.
Hey everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 170, Interstitial Cystitis and Bladder Pain.
Oh, we have some exciting and probably unknown to you forbidden information relating to this constant and severe bladder pain, because this is very serious stuff. This is very painful. Let me tell you, this is how I got into nutrition.
It is.
Well, I don't know so much nutrition, but it's definitely how which was fortuitous, which was wonderful, that we got into selling Standard Process, a whole food supplement company,
yes.
Because we went to a seminar and we were just starting to get into this healing phase of where melting my breast lumps, which I had when you married me, and all kinds of different exhaustion and depression and all these problems. We went to a seminar that Standard Process put on. The president of Standard Process, Mark Anderson, came to me, president of Standard Process West, yes. Mark Anderson, came and presented this seminar. And it was a wonderful seminar. It was on antioxidants. I still remember it. And it was so mind-shattering because antioxidants were the big thing. This was back in 2001?
Yeah, it's almost 20 years ago.
A long time ago. So I walked up to him after because I was blown away with the seminar. And I walked up to him afterwards and I said, Mr. Anderson, if you can get rid of my constant and continual bladder infections, which I didn't know what else to call it back then. It wasn't an infection. But if you can get rid of this horrible pain that I have almost constantly, I'll sign up. I will become an account or whatever you want to call it,
right,
of Standard Process.
Right.
And he looked at me and kind of smiled, that little wire,
yes. That
smile he has, and said, oh, that's an easy thing. So anyway, and of course he did. And that's history. That's how we got started in Standard Process because of chronic interstitial cystitis. Yes. I just call it cystitis.
Yeah, well, that's good
which
enough.
Is just a massive infection.
Interstitial is just the tissue
it's not
underneath
an infection,
the mucosa.
Actually. It's an irritation, an inflammation
yes.
of the tissue underneath in the bladder.
Yep.
Which we're going to talk about, and we're going to actually tell you what you can do for this to fix it permanently.
Yeah, and what we're going to talk about is this may not always be an infection problem.
Yeah,
in fact, infection is often not the problem.
And that's what I thought. I was always going to the doctor, getting antibiotics for this, and always thinking, and they were scaring me to death and saying, oh, it can go to your kidneys and destroy your kidneys, and you have to get on, and it was continual. It never got better.
Yeah.
So I'm really excited, but I have to tell you too, this time we're going to give you a special gift for you at the end of this podcast, yes. But because we don't get credit, which counts as a listen on iTunes or on YouTube,
which increase our numbers.
Yeah, we don't get credit unless you listen all the way through these podcasts. I know that's weird, but if you listen for 20 minutes,
And then,
Then it doesn't say we've had, because we've had over 500,000 downloads.
Oh, yes.
But we need everything we can get. We've got to change the world with this forbidden information. And if you don't listen all the way through, we don't get credit. So at the very end of this podcast, I'm manipulating you and forcing you. But we're going to mention a very special coupon and gift that we're going to give you at the end of the podcast. And besides, you need to listen all the way through.
Well, yeah, some of the answers, we create the problem in our discourse between us, but we give the answer at the end, towards the end of the podcast.
We already have the problem. We women with interstitial cystitis, this bladder pain, we already have the problem. So you're going to want to listen to this if you're a woman, if you're a man, and you're tired of this. Well, I shouldn't say tired. If you feel so bad for the woman in your life that has this pain.
They get in a cycle they can't get out of. And we're going to talk about what causes a cycle and how to get out of it.
And all they think they have is to go to a doctor. And I mean, what else do they know? So anyway, we'll get into it. But
before we get to that, for our regular listeners, the next 4 minutes is our financial stuff. You can fast forward through it if you choose. But for our new listeners, I said regular, I mean new. Please listen at least one time so you understand how we do things around here. Before we begin this informative and forbidden podcast, we want to take a few minutes to talk about why we do not have sponsors.
Yeah, we've been approached many times to sell different products on our show.
But we've always been compelled to resist these financially tempting offers because many times they lead to an attempt for editorial control over what we say.
Yeah, and what we're doing here is too important to be controlled by corporate interests. So we never allow this kind of advertising on our show.
And so that said, we don't make money from these podcasts. All of our income comes from your interaction with us and what we have to offer and from the sale of our Forbidden Doctor products and supplements from the oldest and original whole food supplement manufacturer in the United States, Standard Process.
Yeah.
But we're not paid by Standard Process. Indeed, they distance themselves from open internet promotion because of constant scrutiny from the FDA.
Yeah, and as a result, they do not advertise or pay for advertising outside of a licensed healthcare professional's office.
And the reason for this is really simple, because their products are very powerful and they actually work.
Yeah.
So they need to be careful about people making claims. Others have mentioned that while the knowledge we share can't be found anywhere else, it is often tied to Standard Process.
Yeah, and that also includes our own ageless thyroid and long life energy enzymes products.
Yes, and so you might ask, could not our own products be creating a conflict of interest? Mm-hmm. I mean, have we mistakenly created infomercials instead of free knowledge podcasts?
No, we do this on purpose.
Yes, because years of experience on the radio and in our clinics and almost 500,000 downloads of our podcasts have taught us a few things. And the most important is that the type of nutrient-dense foods that most of us need to get our bodies actually healing from years of malnutrition are not easily integrated into most of our lives.
Yeah, the quest for excellence in nutrition has never been an easy task. Just face it, nobody wants to eat raw liver. But absolutely no one will sign up to eat raw liver daily for 6 months. So we feel therapeutic supplementation is sometimes very critical in the healing process.
Yes, it is. So let us be clear. We talk about Standard Process because this is how you can get whole foods in a concentrated form that you would never, ever eat on a daily basis.
Mm-hmm. And the reason we do our podcast this way is because it has saved our lives and countless others that we've worked with over the years.
Yeah, so we sell supplements.
Yeah.
And so we try to give free knowledge away about how nutrition touches every aspect of our lives. And so necessarily these two are going to overlap. But the bottom line is, we may mention supplements that you can get from our website, but the knowledge we share is real. And you can take that with you forever, whether or not you ever buy anything from us.
But you can support us in keeping this podcast on the air with a donation at forbiddendoctor.com/donate.
Yes.
Or if you're ready to take your first steps for your own health, you can join our family by going to our website and taking our free symptom survey.
Now, we understand, we really do, that some of you may feel real hardship with even a modest purchase and cannot afford even a single month's supply of supplements. So please know then, it is completely okay if you do not buy our supplements or financially support our show in any way if you cannot afford to.
Yes.
However, there are many ways to support us for free. You can give us a 5-star rating on iTunes. That's easy. Or a thumbs up on YouTube. Wherever you listen to our podcast, just give us a good rating.
Yeah, and if you already support the show, thank you. Truly, thank you. And please know that you are the very reason we fight this good fight. I mean, your support makes this all possible.
So now let's get back to the forbidden information they don't want you to know.
Oh, yeah.
So,
all right.
but before we get to that, we've just got to read what a patient of Dr. Jack, because I only call him Dr. Jack at home.
No. I require...
Dr. Jack Stockwell.
Yeah, she has to call me, oh, doctor, are you ready for dinner?
Well, this came in on our little Google reviews, and it was just wonderful. And I happened to mention or see it the other day, so I'm like, we got to put this on our podcast. So you told me about this patient earlier, and I'm just so proud of you, baby. But here's, quote, unquote, her review.
She's 40 years old and had a very difficult birth with forceps.
Yeah, and I like the way you described that on the local radio show where you were giving a presentation. You said, forceps with the French were made to just make the vaginal...
the birth canal wider.
Wider, but not now. Now we yank them out.
Just grab the baby and pull it out.
Yeah, just pull this baby out.
The American way.
Well, and this is what they do with C-sections, which all my babies, all 6 of them were C-section. That's not a natural way. You're supposed to have pressure on your head, but what do they do with C-sections? They grab their head and yank them out. Except for our child that we had together, our Rourke. You made them cut me wider, which they don't like to do because, you get a bigger scar. No. But you made them cut me wider, so they gently pulled him out with his shoulders.
I wanted their hands inside the uterus, cradling his shoulders and head and neck as they pulled him out.
Yeah, not this yanking on the head, which gives them a hanging injury, which they grow up misaligned and terrible problems. Yep. It would kill an adult is what you say. But a child is so malleable. You can bend their arms.
Oh, they're just rubbery. Yeah, you bend them over backwards.
Yeah, so it doesn't kill them, usually. But you think it causes a lot of SIDS.
Well, read what she has to say.
She says, my upper neck pain is gone. Completely gone. I'm still in shock that after one visit to Dr. Stockwell and Associates, this chronic pain causing headaches and migraines I've had since childhood has disappeared. Didn't she have migraines every day?
Yes. It was just a matter of intensity.
Yeah. I was skeptical that one appointment could help so much since I have talked with doctors and tried so many different solutions: physical therapy, massage, acupuncture, chiropractors, because you don't do what normal chiropractors do, acupuncture, medications, etc. But none of these gave me more than a few hours of relief. I would strongly recommend this place to anyone who has neck or back pain. We shouldn't be okay living with chronic pain.
Yeah, and that was just this month.
Yeah, April 12th. Yeah, 2019. Right. So, and before we jump into our podcast, we also want to remind you about our free symptom survey, which we offer on the homepage of our website, forbiddendoctor.com. And now
on with the things they don't want you to know.
Okay, guys, we have a weekly feature called Forbidden Secrets They Don't Want You to Know. And these are the secret things they keep from you, the dumb things they tell you, and the really important things they know nothing about. But this entire podcast is going to be about that today.
That very thing. The very thing you started our discussion off with, interstitial cystitis.
Yeah.
Do you want me to take it from here? Well, interstitial cystitis, a bladder pain syndrome, it's a chronic bladder health issue. It's a feeling of pain and pressure in the bladder area. I know you laugh every time I say that.
I just love it. They're like, if you feel some discomfort, are you kidding me? This is severe. This is severe bladder pain. And, it ends up just being the doctor's pronouncing it psychosomatic because it is severe. But go ahead with the medical definition.
The difference between cystitis and interstitial cystitis is it's deeper into the bladder wall. And usually if
we don't care. It hurts.
Well, that's it. If it lasts more than 6 weeks without having an infection or some clear cause, the honeymoon disease.
Well, yes,
but that's just a bladder infection.
That's an infection. That's actually an infection. But I used to go to the doctors over and over and over again when it would get really severe, and then of course get on antibiotics. And the thing is, my family's really medical. So after a while, after years of this chronic cystitis, I wouldn't even go to the doctor. I would just call my family and say, hey, can you get me a prescription of antibiotics? Because it's getting out of hand and I'm doubled over in pain. So they call this a honeymoon disease, and that really is an infectious type process where you're getting used to new flora and
We're going to talk about flora. We're going to talk about the gut. And any ladies listening to this right now, or guys for that matter, that will be married in 3 to 4 weeks, get on GAPS for 3 weeks ahead of time. And you'll find out why by the time this podcast is over.
Yeah, because you're going to be sharing your flora with your beautiful bride, and you want to be as healthy as you can.
But people don't think about that. You know, dearly beloved, we are gathered here today to mark the moment when they will be sharing flora with one another.
And so this poor woman spends the weekend of their honeymoon in the bathroom on the floor crying in pain.
Yes.
And then what do? They run to an Instacare and get an antibiotic and pain pills.
Starts a lifetime cycle of pain, infection, feeling okay, pain, infection, feeling okay. So the common symptoms include pain or chronic pain in the pelvis.
Men or women. Men get this too, but it's mostly women.
That's true. Persistent, urgent need to urinate, which in men is usually BPH, swollen prostate.
not this.
And frequent, women don't have a prostate.
Well, I know.
Yeah, okay, all right. And frequent urination. Well, there's a couple of women I suspected of this, but anyway. Frequent urination, often of small amounts throughout the day and night, and can be as bad as up to 60 times a day.
Yeah, mine wasn't that bad. I thought mine was bad, but I don't remember urinating 16 times a day. But, a lot of times it makes it worse when you urinate.
Yeah.
So
here's the medical definition. It's a chronic disease of the bladder that is caused by deficiencies in the lining of the bladder, which allows irritants in the urine to leak through the coating of the bladder into the interstitium, which is the tissue just underneath the surface, where all the nerves and nerve endings are located.
Yeah, tell me about it.
These irritants in the urine irritate these nerve endings and basically initiate a cascade of events that is responsible for the symptoms that people with interstitial cystitis have. So part of this cascade is the release of substances that act on mast cells, which then release histamines.
Okay, tell me about the mast cells.
If you got a bee sting, the poison from the bee sting is going to cause mast cells to release histamine. If you get a big breath of some kind of pollen, or some allergen out there that you're allergic to, and you get a big breath of it, suddenly mast cells are releasing histamine. Histamine will cause the swelling of the tissues, the itchy, swollen eyes.
Bring blood to
bring blood to the area
to
take care of the problem, to heal, exactly. And so they believe it's histamine that's released by mast cells in the bladder that senses this frequency and urgency. And the irritation also leads to if it goes on long enough and it's serious enough, scar tissue.
Yeah.
Which is less elastic than normal bladder tissue. So when the bladder does fill with urine, it's not going to expand as much as it should because of the scar tissue. So the urgency comes from that.
So what causes these deficiencies in the lining? This is the medical aspect we're telling right now.
Okay, now the lining, just imagine the bladder as a water balloon, and the lining is the balloon stuff that we're talking about.
Okay. So remember, this is the medical answer. We don't really know for sure.
Almost any medical site
you can
go to online for interstitial cystitis, cause of disease.
Unbelievable.
We don't know.
Literally, I cut and pasted this in. We don't really know for sure. They believe that a majority of people with interstitial cystitis, the cause of the damage to the lining of the bladder, is a chronic exposure to low-grade urinary tract infections for many years and at some time in the past.
Yes.
Well, yeah, maybe so, but why is that happening? Why are they not clearing up this urinary tract infection?
Well, what are the symptoms?
It's like the worst urinary tract infection that you've ever had that never goes away.
Oh.
That's what interstitial cystitis is. And it's a triad of symptoms. It's like you got urinary frequency, urgency, and then the pain. Severe urinary frequency I mean, it may feel like that you have to go to the bathroom every single hour.
Well, I have female patients who tell me that they feel that way, that they feel like they've got to urinate even after they've gone to the bathroom and urinated.
Because it's still painful. And, I remember I would have to go sit in a hot tub you could put a hot water bottle on you too. But I remember that was the only thing that brought any type of relief. And it worked, but it didn't cure anything.
Well, in the medical literature, at least 90% of patients have some manifestation of pelvic pain with this. And of course, different people have different interpretations of pain. I mean, for some people, the pain's deep pelvic pain, and some other people, it's the urgency.
That's more what I have.
Yeah, that's very uncomfortable. And women can have pain with intercourse.
Yeah,
if it's bad enough, even sex can hurt it.
Yeah. So it's a devastating disease. They call it interstitial cystitis, and it's really devastating. It has a tremendous impact on quality of life, on your social relationships, and even on your ability to maintain jobs, because it can completely disable you. In fact, some people with IC, interstitial cystitis, are on disability because of the symptoms.
Boy, that's pretty bad.
It's real bad.
So what are the answers out there?
Well, I did this. I Googled cystitis or interstitial cystitis, and it was just incredible. And this is what makes us so sad. This is what keeps us going as a forbidden doctor.
Yeah.
Because people will literally type that into Google, and the answers they get they're almost criminal.
And there are major websites out there that are removing alternative healthcare answers that conflict with drugs for everything, drugs for anything.
And this is what they're left with.
Yeah.
So the thing that they say, the first thing you do is, take over-the-counter painkillers. Just
in
get
other
rid
words,
of the pain.
it's hurting bad enough that it's causing pain. Let's just get rid of the pain.
Ibuprofen.
Rather than, and paracetamol, rather than going after the cause of the problem, let's just take some painkillers.
It's like putting a little piece of tape over your oil light in your car.
There you go.
Let's just get rid of the pain. Then they say, drink more fluids, which is probably good, such as water, to help flush out the infection. Wow, but nothing to support the reason why you got the infection.
Yes.
Or anything else. It just says drink more fluids. Okay, well, it's not the worst.
This is why they have no cure.
And put a warm hot water bottle on your tummy to help ease any discomfort. I like the way they say, it's discomfort. No, it is severe pain.
Oh.
I hate the way they just minimize this. That's not the right word. What's the word where they...
Simplify.
It's not simplify. It's like they don't give it any value. They don't see it as something. This is very serious.
Yeah.
And guess what? It's getting worse and worse and worse. As any of you men know out there, your wives or your girlfriends or your mother or your sisters or whoever has this, it doesn't get better.
No.
You have to do something about the reason for this happening.
Well, this is the biggie of what they know nothing about.
Oh, this is huge. You're going to die.
Mary, let me ask you, in the deepest of your research, what foods soothe the bladder?
This is on Google. This is Google's advice. You're not... Okay, so...
This isn't funny. I'm sorry.
No, it isn't funny, but it's kind of funny because... At least to us, it's kind of funny because we run across this so much. Here's the foods that won't completely eliminate discomfort, quote unquote, but it will soothe bladder pain, just the bladder pain during flare-ups.
And this information is only 3 years old, 4 years old.
Yeah, it says June 22nd, 2015. This is what I came up with. This is what will help soothe the bladder. Number one, you need to eat more corn.
Oh, you can't be serious.
Corn, and then oats, and then potatoes, and then homemade zucchini bread, and then homemade white or yellow cake.
No.
I don't know why it has to be white or yellow, but it says homemade white or yellow cake. Then ricotta and string cheeses. That will help. Who knew? And then oatmeal or sugar cookies. And then the mother of them all, You need to eat more vanilla ice cream to soothe your bladder. Literally. There's Google for you.
I'm stunned.
Yeah, I have a family member that works for Google, so I hate to discredit them, but this is stunning.
These are foods that apparently do not completely eliminate discomfort. But could soothe bladder. Well, listen, in all honesty,
during flare-ups.
I know I have a DR in front of my name, so I'm going to use my authority at this point. Vanilla ice cream can calm a lot of pain.
Emotional pain.
I wonder why vanilla. I wonder why not
I don't
black
know.
raspberry.
Yeah, see? And they should have put like a brand there, like Haagen-Dazs or something. That's the best ice cream.
Vanilla ice cream. That was on the internet.
Yeah, sugar cookies, white or yellow cake, and vanilla ice cream. Granted, they have corn and oats and potatoes, which, massive carbs, which...
I know. And most of these are foods that will promote an alkaline urine. And we're going to get to the alkaline urine thing.
It will cause a lot more problems.
Well, how does medicine tackle this problem? Because... yellow cake and ice cream sounds like a nice thing for after dinner tonight, but I don't have any bladder pain. Yeah. If I had bladder pain, I'd be asking for it. But if that doesn't do the trick, your medical doctor is going to prescribe something.
Well, we'll get to this, but here's the scary thing. I don't know how many people are hearing this podcast, and you should forward it to as many women as you can, but I'm telling you, 99% of the people out there are going to Google this, and they're only going to hear these things. They say, although interstitial cystitis cannot be cured, there are many ways to treat it.
Symptom management.
Just symptom management. It says, and I'm reading from Google here, it says there's no way to predict who will respond best to certain treatments. Symptoms of IC, that's interstitial cystitis, may be more severe or may disappear. Even if symptoms disappear, they may return after days, weeks, months, or years. No kidding. Really? So it says right here, treatments for IC are aimed at relieving symptoms. There is no cure for this. Doctors will help decide the appropriate treatment for the patient. Do you notice that? Far be it from you to investigate alternative treatments for a system that says it can't be cured.
Yeah, well, once medicine says there's no cure, then the argument's over.
It's over. But do you love this? It says doctors will help decide the appropriate treatment for the patient. Me, the patient. They will decide the appropriate treatment. We're going to give you forbidden information that's going to get rid of this permanently. Okay, so the medical treatments include the following. Number 1, oral medication. So the oral medications that they say can help this are aspirin, ibuprofen,
acetaminophen can help with mild bladder pain. But if you have stronger needs for pain medication, talk to your doctor.
It's always the doctor. Okay, don't take care of this yourself. Talk to your doctor. This is what's known as job security for doctors. So the only drug approved for interstitial cystitis is something called Elmiron, and it is can you say that?
Pentosan polysulfate sodium.
It's a medication approved.
Elmiron, yes.
Yeah, it's the only medication approved for treating the pain of IC. So
they have to be taken for up to 6 months before any improvement is noticed.
I mean,
when's the last time you did something for 6 months looking for a change, and it just happened on the last day of the 6 months?
Well, and that's weird because drugs usually work immediately. That's why people like them and use them.
Well, it's a sulfa-based drug. It's not an opiate for pain. It's
I guess an opiate would work right away.
It's designed to help rebuild the inner lining of the bladder, which obviously could take some time. But as Dr. Lee explained 4 decades ago...
Wait, back up. How does this drug rebuild the inner lining of the bladder?
Because it stimulates a certain GAGs, glycoaminoglycans. It's a certain kind of sugar protein formation that stimulates tissue growth. You have a lot of GAGs in your body in different places, glucosaminoglycans, and you have them in different places in the body, one which is the lining of the bladder. And so they found that this drug in some cases can stimulate growth of that tissue, but it takes 6 months in some cases. And then that's only some cases that they even begin to get any kind of a relief. So the idea is to stimulate tissue growth.
Well, it's a sulfa-based drug, and
that's dangerous.
And this is what I took for years. Every single time I had a bladder infection, quote, bladder infection, which was just cystitis, that's what my family and other doctors would prescribe for me.
Well, here's some forbidden knowledge.
Dr. Royal Lee,
yeah,
who we named our long life energy enzymes after, explained over 4 decades ago the sulfa drugs harden the kidneys, and the government back then outlawed it for Korean War soldiers.
Yeah, the sulfa-based drugs.
Or any soldiers from then on. But we still get it.
Sulfanilamide, I think is what it is. First started showing up in the 30s. The sulfa-based drug showed up before the antibiotics did.
Right. But we still get them.
And after a couple of decades of use of it, they began to realize that the chemical in this drug didn't stay in a solution. When it entered into the body, it started to precipitate out. And of all the places in the body, it crystallized inside the kidney.
Kidneys, yep.
And so it caused hardening of the kidneys. And in Korean War, all kinds of dirty injuries all the time, bullets, mortars, explosions, whatever. And so they had very dirty wounds, and they would pack them full of the sulfa drug. And they found out it started having serious kidney problems, so the government ordered it stopped for Korean War
Sounds
wounds.
like cholecalciferol with vitamin D that everybody's taking. The same damage that happens to the kidneys. A little bit different, but regardless, hurts the kidneys. Not the best way to go.
Yep.
Not the best way to go.
And then there's also the problem with sulfa drugs and the pancreas.
Yeah, it creates severe pancreatitis, we found.
Yep.
That's
one of the warnings, one of the side effects.
Hypersensitivity to sulfa drugs can also create severe pancreatitis, quote unquote.
So the only drug prescribed by the FDA, allowed for the FDA for interstitial cystitis, Elmiron, has some interesting side effects.
Yeah, and they're also told to take copious amounts of water with these drugs. And you know what? For all the years that I took this drug or sulfa drugs, I was never told, well, maybe I was, but I don't remember, told to take copious amounts of water. So,
well, when you have frequent urination, your basic inclination is to not drink so much water.
I know
so you
that
don't have so much
I
frequent
would try
urination.
not to because it hurts so bad to urinate. So the side effects, go
of
ahead.
that drug: diarrhea, hair loss, nausea, headache, stomach upset or pain, abdominal pain, dizziness, depressed mood, itching or skin rash, unusual bruising or bleeding because it causes blood thinning.
Blood in the stools.
Yes, blood in a stool, mental mood changes.
Oh, I didn't have any of
heartburn,
that.
Or discomfort when swallowing.
Okay. Discomfort when swallowing.
Can you imagine
How would you like something better than that?
Well, can you imagine a list of things like that if somebody said, well, you need to eat some good organic apples? Well, let me tell you the side effects.
Okay, I'm going on with the let's see, what is this? This is the medically prescribed treatments for interstitial cystitis. The next one is medicines that treat heartburn may help the systems of interstitial cystitis by reducing the amount of acid made by the body. I just want to scream here. Because there's no way that the acid from your stomach can affect your bladder. Because first of all, it has to go through the blood. And if you could change the blood pH by the stomach acids, we'd all be dead.
We wouldn't. Yeah, that's right.
We'd all be
because it's
dead.
going to go from the stomach through the portal vein into the liver, where buffering is going to take place before it ever gets into the major blood population. And there's nothing you can eat, drink, or eat or take that's going to change your blood pH.
How is that going to change the acid in your bladder? Because you need your bladder to be more acidic anyway.
Yeah,
that is the
uric
problem.
acid. It's a collection of uric acid. Your urine should be acidic.
Unbelievable.
Muscle relaxants.
Well,
muscle
okay,
relaxants.
you can go on to muscle relaxants, which is crazy in and of itself. But I just cannot believe they would treat cystitis with antacids. I mean, not only are you not going to be able to break down your proteins anymore, it's not going to create pepsin and everything else, the downstream effect of digestion. Suddenly, you're going to have massive gut problems from this.
Yeah, well, we're going to be talking
But they're using this as a treatment for cystitis. This is what blows my mind.
Yeah.
Okay, move on.
Well, muscle relaxants can relieve symptoms by keeping the bladder from squeezing at the wrong time. That's what the book says.
I'm sorry. We don't want the wrong squeezing on the bladder.
Like my bladder squeezing.
We need to control this. Are you kidding me? We can't have the bladder squeezing whenever it wants to.
You're going to love the next one.
No, we have to control when the bladder squeezes. Are you kidding me? Okay, here's the next one. This one's going to make all of you scream out there in podcast land.
Antidepressants. Antidepressants can be used to relieve pain in patients with interstitial cystitis because the tricyclic antidepressants such as Elavil, which is simply amitriptyline, have been shown to reduce pain and reduce frequent urination in patients. You get enough amitriptyline, you're not going to worry about
Okay, I don't
pain.
care about amitriptyline. This is the classic case of people with cystitis. They are diagnosed as psychosomatic, a.k.a. it's all in the mind. They're irrational.
Yep.
Are you kidding me? There's no infection in here. We've taken, your bladder. We've checked it for infection. There's no infections. You just need an antidepressant.
Yeah, you're a little nutty anyway. You're just a little nuts.
Women of the world should rise up and just smack all the men all at once. Just because I asked you before this podcast began, have you ever had a bladder infection?
I don't think so.
See? So because
I'm a man.
You don't know. You do not know about this.
Well, how about we inject your bladder with a liquid medicine? We're going to put DMSO in there and a mixture of heparin and the pain medicine,
blood thinner.
lidocaine.
Heparin is a blood thinner.
Yeah, we're going to put a little catheter up your urethra and we're going to fill your bladder with medicine.
A lidocaine, which stops pain.
Yeah, just the same thing the dentist gives you.
That's going to cure a lot. Okay.
How about diet?
No. We can't move on. So you have to understand, this is what they do. These are the treatments for IC. The doctor places a small catheter or tube in the urethra and slowly fills the bladder with the medicine. And it says these medicines can ease irritation because, it's just irritation.
Well, it's lidocaine.
It's just irritation. It's not like pain. These medications can ease irritation of the bladder wall. Aww. I'm sorry.
How about diet?
Okay. Go ahead.
So, for patients who have interstitial cystitis, acidic foods may irritate the bladder. Why? Because that acidic food is going to turn into an alkaline ash. And the alkaline ash will raise the pH of the bladder to a more alkaline setting instead of acidic. And that alkalinity of the fluid will burn the wall of the bladder.
And this flies directly in the face of, you don't want a lot of stomach acid, because you don't want that acid getting down to your bladder, which is
physiologically impossible.
Yeah. So they're saying that.
So get alcohol, caffeine, carbonated beverages, chocolate, tomatoes, and artificial sweeteners out of your diet.
And your doctor may also recommend taking an antacid with meals to reduce the amount of acid that gets into the urine.
Well, that's utter nonsense.
Let's make a big pause here.
Physiologically impossible.
Yeah.
For that to happen.
But they do, Jack. This is what's scary. This is a forbidden information. They will prescribe an antacid on the completely ridiculous theory that acid from your stomach is going to get into your bladder. I mean, really?
Well, they don't understand nutrition. They do not understand nutritional chemistry or science because they're not taught it. It just simply is not on their radar.
Regardless, they should not do any harm, as
Yep.
we always say. First, do no harm. You give a patient, a poor woman with this horrible pain, an antacid, and no longer are they going to be able to break down their proteins to rebuild their body
Yep.
or the lining of their bladder or anything. It's like, can you take a hammer and just like smack me across the head? Because that's going to have as much effect, in a bad way.
Well, let me give you another
than
good one.
an antacid will.
Let me give you another one. Good physical therapy. The Kegel exercise that you were taught when you were pregnant to hold on to your urine when you have an urgency to urinate. The pelvic muscles hold the bladder in place and help control urination, but exercising these muscles can help reduce the symptoms of interstitial cystitis.
I tried to hold my laugh.
Yeah.
Okay, and then they also said physical activity. In other words, you just need to exercise more. That's going to fix this. And then, of course, reducing stress. How about reducing the stress of the doctor prescribing antacids? See, that raised my blood pressure. That caused a lot of stress.
Well, if you don't know where the muscles are that you need to exercise, one way is to correct the muscles is to
Wait. You're going on with what they're saying is okay to do?
Yeah, the physical therapy part, the physical activity, reducing stress, and then physical therapy. You got to find out where those muscles are that control urination. And, if you are trying to keep yourself from, you had too many carbs for lunch and you got a
yellow cake and
yellow
white cake
yes.
and ice cream.
And you have a business meeting that afternoon and suddenly, oh my gosh, I got to get out of this room. Something is about to explode.
I got to have some gas
The muscles that would hold back that gaseous explosion, Vesuvius in the pants, are the ones that help to hold urine.
Honey, you have to understand, though, they're saying this is going to help your interstitial cystitis. To exercise that muscle that holds back farts. That's what they're saying. That is their cure for interstitial cystitis.
I understand.
Okay, keep going. Here's another one.
How about stretching the old bladder?
Yeah, this is good.
This is a treatment where water is inserted into the bladder to stretch it. And this helps make the bladder larger and helps you to hold more urine.
Oh, well, see, that's the problem.
And so you're given an anesthetic to prevent pain and help to relax the bladder muscles. So we're going to put a little fluid into your bladder. There's a medicine in there to numb, lidocaine probably, to numb the walls of the bladder. And now we're going to turn on the faucet.
And we're going to stretch the bladder.
Remember those balloons you got at birthday party?
So you don't have to go to the bathroom 60 times a day.
That's right. You don't have to go 30 times because we've increased your bladder by,
I guess that makes your
100%.
quality of life a little better.
Yeah.
It doesn't fix anything.
I'm sorry if we're a little lighthearted here, but the answer is so simple.
Okay, but the next one, this is a good one. This is another thing they recommend, is nerve stimulation. It's a treatment in which mild electrical pulses are sent to the nerves to control the bladder. Because heavens, we don't want the bladder doing what it does naturally.
Yeah.
Then, I'm reading again, the electrical pulses are delivered through electrodes placed on the skin. The nerve then releases endorphins and block pain naturally. That doesn't sound very natural to me. If this therapy works, the patient may consider having a device placed in his or her body that delivers small pulses of electricity to the nerves around the bladder.
Oh, it feels better.
It's like those dog collars, Don't you go to the bathroom until I say you should go to the bathroom.
Oh, my goodness. And then, of course, the last resort.
Here's a big one.
If none of these other beautifully inspired from heaven ideas work, there's always, let's just take that bladder out.
Yeah. You need surgery, okay? The surgery will remove parts of the bladder or even the entire bladder. Take a deep breath. If the patient has tried every other treatment option and pain is unbearable, surgery may be considered.
This is from the clevelandclinic.org. You can read all this stuff for yourself. And it says, if every other treatment option and pain is unbearable, well, you haven't tried every other option.
You've tried every medical option. But then what do you have to do if you have your bladder removed? Oh, tell us, Mr.
Well, you're going to have to, either they're going to put in an artificial bladder that's got a faucet on the outside. So you can, enjoy the
You can
privileges.
control your bladder when you want.
You can enjoy the privileges of a man where our bathroom is anywhere we want. Or you'll have
That's true.
a leg strapped on catheter into a bag that you can drain at your convenience.
That's sexy. Yeah. Having a little catheter bladder
Well,
right there on
it is
your
like
leg.
the worst urinary tract infection you've ever had that never goes away, as we've been saying. And it's a triad of symptoms that includes frequency, urgency, and pain. And the sense of constant urgency is present even when you've already gone to the bathroom.
Yes,
Now,
I have experienced this.
If you are having any experience with interstitial cystitis or just cystitis, and none of these things have worked for you, we have an
and your
answer.
bladder is removed, but you still like to fix the problem.
Or you've filled up your bladder with helium. You still even talk funny. All right, I'm getting
lidocaine.
ridiculous.
Then there's
I can't help but get ridiculous when I read this stuff.
It's ridiculous. More cake. But there's the brilliant Dr. Natasha Campbell McBride, and she explains how chronic cystitis comes about.
Yes, now you're going to learn something.
The forbidden information that you won't find on Google, of course, unless you Google Dr. Natasha Campbell McBride and cystitis. Okay?
And if you need to take a break, put this on pause for a moment and go to the urgency that's
I think
requiring.
I need to take a break.
And then, because you want to hear clearly what we are about to talk about.
This is amazing.
Yes, Mary, that truly is amazing. And then there is as you said, the brilliant Dr. Natasha Campbell McBride.
Okay, this is the way she explains it, and we're just going to go through this really quickly. But in the first few weeks of life, a baby's gut flora is established,
Yes.
and this is critical. But apart from the gut, in the first few weeks, other mucous membranes and the baby's skin also get populated with their own flora.
Yeah, we're talking about a newborn, just within
Brand
hours
new.
to days of being born.
The mucus and the lining of surfaces play a crucial role in protecting those surfaces from pathogens and toxins, as we
Yes.
all know.
Yeah.
I'm kind of reading from her, so I'm sorry if it sounds a little reading.
No,
but
it's fine.
I want to get it really right here.
Yes.
So beneficial bacteria in the bladder and the urethra maintain a protective mucus barrier produced by the cells of the bladder lining.
Yes, the bacteria is necessary for that bladder to work correctly. Remember, there's only 2 inches from the opening of a urethra into the bladder of a woman. In a man, some men it's several inches, but it's a lot longer, and the body has ways of protecting the bladder from bacterial infection in a man much better than in a woman.
Yeah, obviously,
But in
because
a
you haven't
newborn
had
baby,
one.
In a newborn baby, we're talking maybe an inch.
Yeah. So this process of the interstitial cystitis usually starts as a baby.
It starts as a baby.
So they acquire abnormal flora in their gut because, they weren't nursed, or they were C-section, or the mother, had really bad flora herself, which is the case so much now. And then her groin and vagina gets abnormal flora too, because that flora comes from the gut.
Yes.
I don't know if people realize that.
That flora, that the good flora, the bad flora, which either one that comes out of the gut comes out of the rectum, and it gets into the groin. Even though you clean yourself really well after a bowel
it's
movement,
not that you shouldn't.
you can't see the billions of microbes that are growing there.
Well, and this
And
might
they
get
migrate into the vagina.
yeah, and this might get a little gross. So you guys just listen. But when you first get married, you've got a husband, with a woman, and he's kind of poking there, and he pokes around, and the flora from him gets all over.
Oh, yeah. And within a few months of marriage, you guys are sharing the same flora.
Yeah, and so this is critical. That's why you got the honeymoon disease. But if you've got good flora to begin with when you're first born, and you have a good flora from your mother, you shouldn't get so much of this honeymoon disease.
yeah.
You'll get some, but you should be able to get on top of it. So this usually starts as a baby, and they get the abnormal flora, and at the same time, the urethra and the urinary bladder gets the same or similar vaginal flora. And in a normal situation, this would be predominated by the bacteria lactobacteria.
Lactobacteria is one of the very beneficial bacteria in the gut that will end up in the groin and in any orifice it can get into.
Yeah. And this good flora, this lactobacteria that we're talking about, produces hydrogen peroxide, and it reduces the pH in the area to be more acidic, which does not allow pathogens to adhere.
It's one of the reasons why our colon should be acidic.
And
so should the vagina, so should the urethra, and so should the bladder.
The bladder, yeah. Then the unprotected urethra and bladder fall prey to any pathogenic microbes causing urinary tract infections.
That's if you do not have the correct flora in the gut.
To begin
you're
with.
going to be a sitting duck for the bad bacteria in the bladder.
Okay. In gut dysbiosis, large amounts of various toxins are produced by pathogens in the gut and absorbed into the bloodstream through the damaged gut wall. So these toxins leave the body in urine, because urine is the venue that toxins are eliminated from one of them eliminated from the body, and it accumulates in the bladder. When this toxic urine comes into contact with the bladder lining, you burn.
Yeah.
Okay.
And as Dr. McBride said, the beneficial bacteria in the bladder and the urethra keep this protective mucus barrier produced by the cells of the bladder lining.
Yeah.
So when toxins do build up for whatever reason, dietary, external factors, whatever, the bladder can handle that problem because of that mucus lining on the inner walls.
But as that mucus lining gets damaged, then these toxic substances in the urine get through the bladder wall, causing the inflammation and leading to chronic cystitis.
Yeah, and this is what happens to many babies, mostly girls, of course. They get their first urinary tract infection very young.
3 months, they're getting an infection.
And as their gut flora, their vaginal flora, the flora of the urethra, the bladder, when they're not corrected, they're going to get these urinary infections all their life and eventually develop chronic cystitis.
Yeah, and then further damage to the gut flora happens as she grows up, okay? You got many courses of antibiotics, and they could be starting for 3 months old when they get that first urinary infection. And through their whole life, of course, every antibiotic damages beneficial species of bacteria in the gut. And of course, that leaves it open to pathogens and everything else that are resistant to antibiotics. Now, even when the course of antibiotics is short and the dose is low, it takes different beneficial bacteria in the gut a long time to recover. So physiological E. coli.
Yeah, the good E. coli.
The good E. coli, we're going to talk about this in a minute, takes 1 to 2 weeks to recover.
Yeah, bifidobacteria can take 2 to 3 weeks. And the lactobacilli, or the peptostreptococci that we haven't mentioned yet, can take a month to recover.
A month.
Even from a low-dose antibiotic.
Yeah, and short and low dose. This is why it's so important to, when you're taking an antibiotic, to not have any sugar for at least a month.
Yes.
It's very critical. So if during this period where, the beneficial bacteria are trying to repopulate the gut is subjected to further damage, such as sugar, serious bad food, and no fatty food, because, these girls, they're so scared of eating fat or eating animal foods.
But their immune system needs those fats.
Yeah, and they're all vegetarians. Or even like toxic makeup for these girls, or toxic hair products, glyphosate in vegetables, because nobody's going out. These teenagers are not eating organic vegetables, organic salads. You don't even find that kind of thing. They sometimes get on birth control. Then the chronic cystitis, it can become chronic.
Yeah.
And then after taking so many antibiotics through their whole life for their urinary tract infections, then these teenagers, which has damaged their gut flora, damaged their hormones, damaged all kinds of things, which we talk a lot about, how that can really alter your gut flora to where you have these faux hormones going into your body and your whole endocrine system is a mess. You come down with acne.
Oh, yeah. And then what's the number one thing for acne?
Accutane.
Yes. Now, Accutane, up till this last year, Accutane's been taken off the market, but we're going to talk about it in the sense that it has several evil stepsisters that work upon the same basis. So we're going to talk about them too.
How do they've been taken off the market?
Yeah, Roche. Yep. Because of all of the lawsuits against Roche for severe liver damage as a result of using Accutane. They finally pulled it from the market here just a few months ago. But it continues to be manufactured worldwide as of 2019 as Absorica, Amnesteem, Clarivis, Myorisan, Sotrit, and Zenatane.
So they're still manufacturing.
Oh, it's still coming out. They just changed the name.
Well, it's attributed with extreme birth defects that women, they say that you must not get pregnant during and for 1 month after the discontinuation of Accutane.
Yep.
So,
and that's severe.
They say sexual abstinence, not even birth control. Yeah. I mean, sexual abstinence. It's so severe that women who become pregnant while taking Accutane, or I guess any of those others, are generally counseled to have an abortion.
Yes, because you can bet there's going to be birth defects.
Massive birth defects.
It was patented back in 1969 and approved for use in 82. And it sold well for years and years and years and years, but they were settling the multiple lawsuits over the side effects. They had to pull it off the market, but it's still manufactured worldwide in several other names, as I just mentioned a minute ago.
Okay, so this, she'll probably be pronounced after Accutane, after all these bad foods and all these toxins and all these antibiotics she's had all her life. She'll be pronounced with digestive problems like constipation, bloating, abdominal pain, lactose and gluten intolerance, which is just an indication that your gut flora is seriously compromised. Yeah. So what do? We run to the doctor and we get antacids and we get all kinds of more drugs to try and help this digestive problem.
Yeah.
And then after the usual long course of this Accutane or other antibiotics for the bad acne, they'll become, like I said, lactose intolerant, which is epidemic in the society. I just talked to, I won't say who, but family member that's proudly proclaimed that they are lactose and gluten intolerant and they have celiac disease, and I didn't have the heart to say anything.
Well, you can't digest lactose without a well-functioning gut flora.
No, not at all.
And the explanation that's offered by science so far is that, after early childhood, we start producing less of the enzyme called lactase, so we can't digest lactose. But if we're not meant to digest lactose, the sugar in milk, then why do some people have no problems drinking milk at all?
Because these people have the right bacteria in their gut.
Amen.
Yeah. You probably didn't know this forbidden information, but one of the major lactose digesting bacteria in the human gut is E. coli. Yeah.
And that comes as a surprise to a lot of people that the physiological strains of E. coli are essential inhabitants of a healthy digestive tract. They hear about E. coli poisoning in this meat or that strawberry or something.
And so we're so scared of it.
Because there are parts of the E. coli family, some strains of E. coli, that are very pathogenic.
But did you know? Go ahead.
But did you know?
Did you know that they appear in the gut of a healthy baby in the first few days of birth in huge numbers?
Yes. The good E. coli.
And they stay in these same numbers throughout life, or should, if they don't get destroyed by antibiotics or other environmental.
And apart from digesting lactose, these physiological strains of the good E. coli produce vitamin K, vitamins B1, B2, B6, B12.
Can you say vitamin B IV therapy? How many women
growing business
are going in and getting IV therapies? There's a little IV bar at this new business. I won't even mention the name. It's down in LA and it's chic and it's incredible.
Yes.
And they sit around in these chairs like they're getting chemotherapy. And they
Give me that vitamin B.
And they get the vitamin B. They even have vitamin C. They have all the different B vitamins. And then they say they have this one that's called the Fat Buster IV.
I wonder how long the line is on that chair.
Oh, I mean, it just blows my mind.
Honey, we're in the wrong business.
I know. Okay, so E. coli produces antibiotic-like substances, and they're called cholecines. Is that how you say that? Mm-hmm. Cholecines, and they control other members of their own family, which can cause disease.
Yeah, cholecines will attack. It's a byproduct of the bacteria itself, a certain strain of E. coli, the good E. coli. Mm-hmm. And those cholecines they come out of the bacterial body and attach to another bad bacteria and break down the wall of that bacteria to kill them, keep them at bay.
So anyway, you just need to understand that having your gut populated by these certain strains of E. coli, which you get at birth, is the best way to protect yourself from other pathogenic species of E. coli. They keep their family members in control.
So unfortunately, this group of beneficial bacteria happen to be very, very vulnerable to broad-spectrum antibiotics.
You mean the good?
The good bacteria.
Yeah.
Gentamicin, kanamycin, erythromycin.
Which you took for years.
Yes, I took that for years because I had a penicillin allergy. And every time I got a sore throat, I went and got erythromycin.
Yeah.
Now, I know better than that now, but back then I didn't.
So then, many times as young as 14 years old, these girls are put on contraceptive pills, and they're put on them, to even out their periods and to get rid of cramps. Some girls are sexually active at 14, but they're on them for years and years and years. And contraceptives have serious damaging effect on the composition of your gut flora. And it leads to allergies, eczema, psoriasis, headaches, ovarian cysts, which is huge, and many other problems that come with gut dysbiosis.
Yep.
So, Jack, you take this.
And so the microbial layer on the absorptive surface of the gastrointestinal tract not only protects it from invaders and toxins, but maintains its integrity and its strength, because healthy gut flora is the very process of digestion and absorption. And so much so that the normal digestion and absorption of food is probably impossible without well-balanced gut flora.
Yeah, for sure. The good gut flora digests the proteins that rebuild every part of our body. It ferments the carbohydrates. It breaks down fats and fiber. And the byproduct of bacterial activity in the gut transports minerals, vitamins, water, gases, and many other nutrients through the gut wall into the bloodstream. And if the gut flora is damaged, the best foods and supplements in the world can't have an effect or have a good chance of being broken down and absorbed.
Yeah, and we're talking about all of this stuff because the overgrowth of that bad bacteria is going to migrate into the bladder.
Yeah. So a good example of this is dietary fiber, which we're all told is wonderful. You got to get more fiber. I know my daughter was telling me that if you want to lose weight, you got to eat more fiber. And true, it is one of the natural habitats for beneficial bacteria in the gut. They live on this. They feed on this. And it produces a whole host of good nutrition for the gut wall and the whole body. Beneficial bacteria absorb toxins. They balance out the water and your electrolyte metabolism. They help recycle bile acids and cholesterol. But when these good bacteria are damaged and not able to work, the dietary fiber itself can become dangerous. Okay?
Yes, it can.
Yeah, it provides a good place. Good bacteria live off this fiber, but
so does the bad bacteria.
Bad bacteria. So the beginning of GAPS, we always recommend no fiber, low fiber. And everybody's like, wait, I thought fiber is good for me. But you got to understand, we got to get this gut bacteria healthy before we can fix this chronic cystitis in your body. And you've got to get low fiber for a while until we rebuild the beneficial bacteria in your gut, because bad bacteria will live on this too. And by the way, did you know that nature provided us with our own factory for making these B vitamins and these substances? It's our own healthy gut bacteria. So girls will consistently, over the years, show deficiencies in most B vitamins. Fat-soluble vitamins, because nobody dares eat anything that has fat in it.
A, D, E, and K.
Yeah, magnesium, zinc, selenium, manganese, sulfur, iron, and some fatty acids, of course. But most women with interstitial cystitis have suffered with anemia for years, and they're exhausted.
Yeah.
And it's unsuccessfully treated with iron tablets. They will still look pale and pasty. You'll look at them, you go, oh, you're lacking in iron. They're exhausted. They can't absorb essential vitamins and minerals because their own gut flora is so diminished. And their own ability to make these vitamins is damaged. Your own gut flora will make the B vitamins. You can't live without B vitamins. And so, we're told if we take B vitamins, you should take them every 6 hours. But truly, they don't last in your body that long. They're water soluble. So your own gut flora has to make this.
Yeah.
And so these people with damaged gut flora have a particular group of pathogenic bacteria growing in their gut, which are iron-loving bacteria. And unfortunately, supplementing with iron makes these bacteria proliferate.
Yeah, especially the Actinomyces, Mycobacterium, Corynebacterium, and the pathogenic strains of E. coli.
Yeah. And then you get more digestive problems like horrible constipation. And it doesn't even remedy the anemia that you have.
Yep.
So this bad gut creates an overgrowth of the energy-stealing fungus.
Dun-dun-dun.
Candida. Yeah.
And there's a strain of Candida running around the country right now that's actually deadly.
It's so bad.
And the media wants to spend all their time talking about something as simple as measles. And they're leaving the Candida discussion out of the picture.
Some people are talking about it.
Because they don't have a vaccine for it.
Yeah.
All right, that's my political commentary.
But it's Candida albicans, which has caused untold misery to millions of people.
Yep.
So it's never, but you have to understand, Candida is never alone in the body. Its activity and ability to survive and cause disease depends on the state of trillions of its neighbors. Remember those family members that are controlling everything?
Yeah, the other bacteria, the viruses, the protozoa, different kinds of yeasts, many other micro little creatures
These are
in there.
all working together and living as a community. In a healthy body, Candida and
everybody in this country has Candida in them.
Yeah,
Anybody
well, it
that's
needs
lived
to be
in
there.
America for 2 or 3 years, eaten the standard American diet, has Candida.
Well, because the era of antibiotics, which cures everything, gave Candida this special opportunity to take over this whole world. So the broad spectrum antibiotics kill a lot of these microbes in the body, the bad and the good, but they have no effect on Candida.
They don't.
They don't touch Candida. So after every course of antibiotics, what do you got to do? Candida is left without anybody to control it. So it grows and thrives. This is why it's so critical to not have sugar after you've had an antibiotic. And the reason we're talking about this so much is because this is what happens to girls before they get the chronic interstitial cystitis. Yes. This is so critical to understand how this comes about. You're a baby, you're a teenager, you go on antibiotics, you go on birth control, you have, acne, all these different things, and then you come down, then you have babies and more antibiotics and you're crying and you're upset and you're exhausted and you're tired and they say, "Oh, it's psychosomatic. Here's an antidepressant."
Yeah.
And here's an antacid for all the heartburn you have because your gut is so bad. So anyway, women that have interstitial cystitis have many symptoms of Candida overgrowth in their body. They have low energy levels, dry skin, recurrent vaginal thrush and cystitis, bloating, constipation, foggy memory, and
lethargy,
the massive exhaustion.
Yep. Right. So the medical approach is just symptom management, primarily trying to reduce the pain and discomfort, not truly addressing the underlying cause. And they admit themselves, listen, there is no cure for this. The ultimate management, of course, is to remove the bladder. So the use of antibiotics to relieve the pain just further damages the gut, and that causes a further overgrowth of the pathogenic bacteria that have taken up root in the bladder and the urethra, causing the problem in the first place. So the continual use of antibiotics just keeps the cycle going.
Yeah, you have to fix the terrain of the gut.
Yes.
The thing that has worked for so many of our female patients is maintaining a proper urine pH, doing gaps, getting their gut healthy again. And many of them have made incredible changes by using the protocol we recommend. And of course, the first thing that we recommend is doing gaps. But if you can't.
But some people need relief within 20 minτης.
Yeah, well, that's what our protocol is made for, but it is also very foundational. There are foods that hurt the pH of your bladder, like yellow cake.
grains, processed carbs, and most of the rest of the stuff that Kraft and Nestle will try to sell you.
Yeah. But you ought to be able to eat cake at a wedding. Okay?
Yeah.
Without getting a bladder
And
infection
if you don't have
or
a whole mess
cystitis.
of kids, you're not going to have a whole lot of weddings to go to. But some of you need to do gaps to permanently fix this problem of interstitial cystitis. But many of you can use the protocol on our website. Search cystitis in the search box at the top at forbiddendoctor.com.
Yeah, 2 will come up. They'll come up with cystitis and interstitial cystitis.
Yes.
One has a few more things than the other. So, but you can relieve the pain and turn around the terrain in your gut on a foundational level to where bladder pain will be a distant memory, as it is now with me.
I can't remember the last time you ever. I remember when we were courting, you'd have to stop at a drugstore and get AZO,
yeah, to stop the pain.
With cranberry based, or you'd get some kind of cranberry.
Well, I used
thing.
to do that real thick cranberry stuff all the time.
Yeah, I remember. I can't remember the last time you ever once complained of any kind of bladder
No,
condition.
and can you imagine me going, oh, I got to go eat yellow cake and ice cream
because my bladder pain is bad.
Can you believe that? That's that's the advice they're getting now. So we have on our website an incredible protocol. There's the interstitial cystitis protocol is not much longer, but it's a little bit longer. It has 3 more products. The other one is really good too, but the top 4 are really critical in my opinion. Actually, the top 5 are really critical, but the first one is Calamo, and it's for severe pain, which we have. It's not discomfort.
No,
it's severe
and it
pain.
usually works in 15 to 20 minutes.
Yep. You take 6 immediately, and then every half hour you take 3 more all day long until the pain stops. Okay? At least for a few hours, and then 2 hours, and you forget about it because the pain goes away so quickly. And then, of course, cranberry complex. This is Medi-Herbs cranberry complex. Take 3 immediately, and then every half hour until the pain stops, take 1. And then every 1 to 2 hours for the rest of the day, take 1 a day for preventative support also.
Yes.
That's a wonderful product. But again, this doesn't cure the problem. So what we like to throw in there is gut support. And the 2 most important, and this doesn't just throw in probiotics. Probiotics are helpful while you're taking them, but once you stop taking them, they don't help. So Zymex wafers actually changes the terrain. It eats the food that Candida wants. So I would recommend 4 Zymex wafers in the morning, 4 at night, because foundationally, cystitis is a gut problem, as Dr. McBride explained. Zymex will support the foundational reason for cystitis reoccurrences. Okay?
And then the other biggie, lactic acid yeast wafers. Again, you want to take about 4 in the morning, 4 at night.
This changes the pH of the colon.
Yes, which is the primary source of the flora coming out of the rectum into the groin.
In the vagina.
And remember, we're talking about these microbes are extremely small. Mm-hmm. And we're not talking about poor hygiene or poor bowel hygiene. We're not talking, they're going to be there anyway because your skin is crawling with these microbes.
And you want to be able to live in the world. You don't want to live this sterile lifestyle.
So you change the pH of the colon that kills off the bad bacteria.
Mm-hmm. Then the 5th item we recommend, the top 4 that we just talked about are really important. The 5th one is a probiotic. It's called ProSymbiotic. And you want to make sure you have a pretty healthy gut before you take this too, because it has a little probiotic inulin in it. This is not the probiotic we recommend when you're doing GAPS. We have one that doesn't have any fiber in it at all. But because you need this fiber if you want the good bacteria to grow on it. So, and then we also recommend Cataplex ACP, which has the vitamin A, the vitamin C, the vitamin P. It's a whole food vitamin A, a whole food vitamin C, so you can rebuild that gut wall. I mean, not gut, well, it will do that too, but the bladder wall and the lining. And then the really strong vitamin P, which is the ACP in Cataplex ACP,
yes,
which is the rutin that really tightens up that leaky gut or leaky bladder lining. And so you can hopefully start to heal that problem. Then we also recommend Alboplex, which is kidney support if you've had serious interstitial cystitis. An herb called Urico Phytosynergist. It's a liquid. It's pretty intense, but it supports the healthy mucous membranes membranes within the urinary tract. And then Echinacea Premium, it helps enhance healthy immune system function and strengthens your vascular walls. So that's really critical, I think. I think every woman should take 3 tablets a day of Echinacea Premium. It helps. We call it the Fountain of Youth pill.
Yes.
For many, many reasons. And then we also throw in another herb for the interstitial cystitis. It's Rehmannia complex, and it supports the liver because the liver is always involved here if your kidneys are hurting too. And it helps with toxic removal. It also, a nice side effect, it removes mild joint pain after exercise and can help relieve occasional mild headaches, which a lot of women have when they have all these different problems. So anyway, you can just go to our website and let me turn this off. You can just go to our website. Again, at the very top, there's 3 search bars. On the far left is the protocol search bar, and just type in cystitis, and you'll get these protocols. Remember, you have to be a member of our website to be able to see these protocols, but they're free of charge to see the protocols.
What if you're not a member?
Then you just have to simply take our free symptom survey, another free thing, and then we will recommend a protocol for you. If you put cystitis at the very bottom, or if you can't spell that, then put bladder pain at the very bottom of the symptom survey.
Yes.
And then, we will recommend this or maybe some other things, but it will be a personalized protocol, which is really cool. I mean, you can go to our website and get this interstitial cystitis protocol, or you can just do our simple survey, and then you will get a personalized protocol for maybe other problems you're having also. So, I told you we were going to give you a gift at the end, but not before we read the disclaimer. Go ahead.
The statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All the information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professional.
And here's the free gift we promised you at the beginning. If you put in your shopping cart on our website the products that we recommended for interstitial cystitis, and or if you purchase the Cart Ready protocol, which is all ready for you, you don't have to think. Just click that one button. It will put them all in there. Or if you put in the 4 top products only, and those are the Cal-Amyl, the cranberry
the ones that are absolutely
complex,
essential,
the Zymex wafers, and the
lactic acid,
which foundationally help this cystitis, you can use a 15% off discount. So when you're checking out, type in the coupon Bladder at the coupon field. That's easier to spell than cystitis, right?
Yes, Bladder.
Bladder, Bladder, and you will get 15% off of the protocol. So thank you for listening to this forbidden information in our Forbidden podcast.
Yes, join us next time for another in-depth discussion of forbidden knowledge.
And it might be Candida
albicans. Yeah.
So
we're thinking about doing that.
Yeah.
All right.
We'll see you next time.
So long.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from Amazon.com by searching the full term Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.